Kasich. You chose to expand Medicaid in your state, unlike several other governors on this stage tonight, and it is already over budget by some estimates, costing taxpayers an additional $1.4 billion in just the first 18 months. You've defended your Medicaid expansion by invoking God, saying to skeptics that when they arrive in heaven, St. Peter isn't going to ask them how small they've kept government, but what they have done for the poor. Why should Republican voters, who generally want to shrink government, believe that you won't use your St. Peter rationale to expand every government program?
Well, first of all, Megan, you should know that President Reagan expanded Medicaid 3 or 4 times. Secondly, I had an opportunity to bring resources back to Ohio to do what? To treat the mentally ill. 10,000 of them sit in our prisons. It costs $22,500 a year to keep them in prison. I'd rather get them their medication so they could lead a decent life. Secondly, we are rehabbing the drug addicted. 80% of the people in our prisons have addiction problems. We now treat them in the prisons, release them in the community, and the recidivism rate is 10%, and everybody across this country knows that the tsunami of drugs is threatening their very families. So we're treating them and getting them on their feet. And finally, the working poor, instead of them having come into the emergency rooms where it costs more, where they're sicker, and we end up paying, we brought a program in here to make sure that people could get on their feet. And you know what? Everybody has a right to their God-given purpose. And finally, our Medicaid is growing at one of the lowest rates in the country. And finally, we went from $8 billion in the hole to $2 billion in the black. We've cut $5 billion in taxes, and we've grown 350,000 jobs.
Gentlemen, the next series of questions deals with Obamacare and the role of the federal government. Mr. Trump, Obamacare is one of the things you call a disaster.
Complete disaster, yes.
Saying it needs to be repealed and replaced.
Correct.
Now, 15 years ago, you called yourself a liberal on health care. You were for a single-payer system, a Canadian-style system. Why were you for that then, and why aren't you for it now?
First of all, I'd like to just go back to in July of 2004, I came out strongly against the war with Iraq because it was going to destabilize the Middle East, and I'm the only one on the stage that knew that and had the vision to say it, and that's exactly what happened. The Middle East became totally destabilized. So I just want to say, as far as single payer, it works in Canada. It works incredibly well in Scotland. It could have worked in a different age, which is the age you're talking about here. What I'd like to see is a private system without the artificial lines around every state. I have a big company with thousands and thousands of employees, and if I'm negotiating in New York or in New Jersey or in California, I have like one bidder. Nobody can bid. You know why? Because the insurance companies are making a fortune because they have control of the politicians, of course, with the exception of the politicians on the stage. But they have total control of the politicians. They're making a fortune. Get rid of the artificial lines, and you will have yourself great plans. And then we have to take care of the people that can't take care of themselves, and I will do that through a different system.
Hey, Mr. Trump, hold on one second.
Newsflash.
I know. Hold on, Senator Paul.
Newsflash, the Republican Party's been fighting against a single-payer system for a decade. So I think you're on the wrong side of this if you're still arguing for a single-payer system.
I don't think you heard me. You're having a hard time tonight.
Here in the Buckeye State, the Governor, John Kasich, took the federal money for Medicaid expansion under Obamacare. And Governor Jindal in Louisiana, you passed on those tax dollars. Why do you think Governor Kasich got it wrong here?
Well, this goes to the question you were just asking. Look, under President Obama and Secretary Clinton, they're working hard to change the American dream into the European nightmare. They do celebrate more dependence on the government. Give Bernie Sanders credit. At least he's honest enough to call himself a socialist. Barack Obama, Hillary Clinton, they're no better. If we were to expand Medicaid, for every uninsured person we would cover in Louisiana, we'd kick more than one person out of private insurance or remove their opportunity to get private insurance. We're going to have too many people in the cart rather than pulling the cart. This isn't free money. I know some people like to say, well, this is free money. We pay federal taxes. We are borrowing money from China today. Yesterday, the president stunningly admitted this. He said, we don't have leverage with China to get a better deal on Iran because we need them to lend us money to continue operating our government. The President of the United States admitting that he's weakening our government's position, our foreign policy standing, because he can't control spending in D.C. There is a better way to provide health care. The Oregon study showed this. Simply expanding Medicaid does not improve health care outcomes. In Louisiana, instead, we're helping people getting better paying jobs so they can provide for their own health.
So Governor Kasich was wrong, just to be clear. Correct?
I don't think anybody should be expanding Medicaid. I think it's a mistake to create new and more expensive entitlement programs when we can't afford the ones we've got today. We've got to stop this culture of government dependence.
I didn't hear an answer regarding Governor Kasich, but for now, I'll go to Governor Pataki. Yes or no?
I'll say this. I don't think anybody should expand Medicaid. I think it was a mistake to expand Medicaid everywhere in Ohio and across the country.
Governor Pataki, three-term governor of New York. Is he right? Governor Jindal?
I think he is right. I don't think you expand entitlements when so many people are dependent on government and when the money the federal government is offering is going to be taken away from you after just a couple of years. But getting back to Martha's question about how we end dependency, do we have to have a cultural change? The answer is no. And I know this because when I ran for governor of New York, 1 in 11 of every man, woman, and child in the state of New York was on welfare. On welfare. Think about that. And people said you can't win, you can't change the culture. But I knew that good people who wanted to be a part of the American dream had become trapped in dependency because the federal government and the state government had made it in their economic interest not to take a job because the benefits if they didn't work were better. I changed that. We put in place mandatory workfare, but we allowed people to keep health care. We put in place child care support.
Would you have expanded Obamacare in the state of New York had you been governor at that time?
No, it should be repealed. And by the way, when I left, there were over 1 million fewer people on welfare in New York State than when I took office, replacing dependency with opportunity.
Thank you.